Moving on. Case vignette and discussion prompts. Vignette. Amira, a 27-year-old autistic, non-binary associate therapist of Middle Eastern descent, has been meeting with Dr. Hartwell, a white, cisgender, late-career supervisor. Amira is thoughtful, warm, and intellectually sharp. They often become visibly tense when presenting cases involving high conflict or strong emotional expression. Amira recently inherited a client with complex trauma who oscillates between intense dependency and abrupt withdrawal. Amira reports difficulty identifying what to prioritize in sessions and worries that their uncertainty means something is wrong with me. Dr. Hartwell notices that Amira tends to mask confusion and often apologizes before speaking. During supervision, Amira hesitates to critique agency protocols that feel culturally misaligned for their clients, fearing the perception of insubordination. Discussion prompts. 1. What mechanisms might be contributing to Amira's tension and the self-doubt? Guidance. Multiple layers are interacting. Neurodivergence. Autistic processing may slow verbal formulation under pressure. Masking behavior often emerges to avoid scrutiny. Cultural dynamics. Middle Eastern cultural upbringing may include deference to authority, avoidance of overt critique, and a protective relational stance. Historical or lived experiences of marginalization can heighten fear of missteps. Developmental stage. Novices often equate uncertainty with incompetence. Complex trauma cases evoke shame when supervisees cannot fix situations immediately. Supervisory threat response. Amygdala activation under perceived evaluation leads to narrowed cognitive bandwidth. Amira's discomfort is not pathology, it is a confluence of identity, environment, and development. 2. How might Dr. Hartwell adapt their stance to support competence and safety? Guidance. Dr. Hartwell might slow pacing and invite reflection. Let us take a moment. What arose for you internally? Normalize uncertainty. Ambivalence is expected in trauma cases. Explicitly name the dual role, mentorship plus evaluation, to reduce unprocessed fear of authoritative judgment. Ask permission before exploring emotionally charged content. Invite Amira's cultural lens. How may your life experiences and background shape how you approach conflict here? Provide neurodivergent affirming supports, written scaffolding, visual models of case formulation. 3. What ethical obligations arise when agency protocols conflict with culturally aligned practice? Guidance. Supervisors must help supervisees navigate ethical fidelity without cultural erasure. They may explore culturally safer alternatives within policy limits. They must not compel supervisees to act counter to their values when a culturally congruent option exists. They may need to advocate at the systems level for policy refinement. This reflects the supervisor's role as steward not only of the supervisee but of the profession's ethical evolution. Practice exercise. Rationale. This exercise helps supervisors strengthen reflective awareness of their evaluative stance, cultural positioning, and implicit assumptions. It supports the development of a supervisory presence that is grounded, ethical, and attuned. Steps. 1. Map your positionality. On paper, write down your salient identities: race, gender, sexuality, neurotype, age, class background, religious influences, language, immigration history. Note which identities hold power in most clinical spaces and which have historically been marginalized. 2. Identify supervisory triggers. Reflect on supervisee behaviors that evoke irritation, protectiveness, anxiety, or overinvestment. Identify possible origins. past training experiences, personal history, bias, fatigue. 3. Link triggers to supervisory decisions. Ask yourself how these triggers influence your feedback, tone, or boundaries. Are there moments you become overly directive or, conversely, excessively permissive? 4. Commit to one behavioral exploration. Choose one supervisory behavior you will explore modifying this week, such as slowing your pace, asking clarifying questions before intervening, or explicitly inviting discussions of identity or uncertainty. Reflection. Questions. 1. How does my own developmental history as a clinician and human being shape the way I supervise others? 2. In what ways does my positionality influence the safety or silence of my supervisees? 3. What structural or technological forces shape my supervisory decisions, often without my awareness?